Hello, we are going to be converting our continuous IV to a saline lock. We are going to prepare and administer our medication according to the 6 rights of medication administration, which are right patient, right drug, right dose, right route, right time, and right documentation. We're going to follow all appropriate precautions and do our hand hygiene. We are going to check our MD order and our MAR. We're going to identify our patient with 2 identifiers. Hey, Ivy Arm, how you doing? Can you tell me your name and date of birth? My name's Ivy Arm, and my date of birth is 0101 of 2000, which that matches my orders, that matches my MAR, and it matches her wristband. So we have our 3 checks of medication administration. So at this point, we are going to wash your hands. We are now going to assess the IV site and make sure it is patent, that we don't have any other problems. Let's see what that's going on. We're going to clamp off our IV at this time. We are going to loosen our IV tubing. There we go. It is clamped. And see, we're gonna disconnect that. And we're holding pressure down on that catheter, ensuring that we don't pop that out. Oh, fudge. There we are. And like that. All right, so at this time we're going to disinfect with alcohol swab. I already have some gauze underneath that hub. I'm going to flush that line. We're going to flush, and we're going to make sure that it is still patent. We also explained why we are going to be leaving this IV in for the time. We still want the access, but we don't need the continuous running of the IV at this time. So I'm just going to leave it just like that, and then we're going to educate the patient on how to take care of the lock, and then we're going to document all relevant information. Thank you. And scene, curtain, break. Hey, Ivy, doc has ordered that we do a push medication through the saline lock. We're going to review our physician orders and our MAR to give this medication. So we're going to do our 3-check method. We're going to determine the rate of the medication for this IV push, which is going to be IV bolus, right now stat. So what we're going to do, and the medication is going to be 1 milligram, and it's 1 milligram per milliliter. So we're going to draw this up with the appropriate size needle and the appropriate gauge. I'm going to put this in here just like so, inject our air, and that was a brand new bottle, so it was disinfected to begin with, and then just for extra that we did disinfect it again. So we did that. All right, we're gonna knock our air out. Yeehaw. Still 1 milliliter. So at this time, we're going to put that in the scoop there. Like that. Oh, nope. Come on, buddy. All right, there we are. So we still got our 1 millimeter. And then we're going to use our alcohol swab, and we're going to disinfect our port vigorously. And then we are going to flush the line with 5 milliliters of saline. Yeehaw, flush the line, determine that everything's going good, and that is still patent. There's no swelling or irritation or pain at the site. Yeehaw. Cool. And then I'm going to determine how quickly we need to do this. And then we're going to do our IV alcohol swab again. Then we're gonna give our medication, as it said, bolus. Do that, give that, assess the patient to see if there's any kind of reaction, make sure they're tolerating the medication well. And then we are going to disinfect the site again and our swab. And then we're going to do that. We're going to flush our with another 5 milliliters of saline. And at this time, flush all that. Look around, make sure patient's tolerating that. Yeehaw. Then throw that away, and then we're going to clean up all our stuff as needed. Dispose of our sharps and sharps container. Yeehaw. All right, scene curtain, and now we are coming back, and we do have an order to discontinue our IV. So this time we're going to put on clean gloves, and we're going to tell you, hey, IV, we're going to discontinue this IV. You're getting ready to leave, or we're going to change sites, or something of that accord. So put on clean gloves, and then we're going to loosen from around the site here, all around the IV with the tape. There we are. And then we are going to, with one quick motion, withdraw the catheter on the site. And then we got some gauze pad here, put that over. What we're going to do is we're going to observe to see if there's any redness or anything going on at that site. And use sterile gauze, cover site with sterile dressing. Discard our equipment as necessary and document all pertinent data. All right, thank you.